Good day. I am Rachel B. Para and I am going to share with you the behavioral problems, meaning, concept, and treatment together with my partner, Ma'am Maria Shanberg G. Dasmariñas. Okay, so what is behavior? Behavior is the action or reaction of something under specified circumstances. And when we say behavioral problems, this is any behavior that disturbs the individual ability to function inadequately will constitute a behavior problem. So here are the common behavioral problems for preschool child. First is the head banging. The second one is the thumb sucking. The third one is nail biting. Fourth, hyperactive child. And the last one is the masturbation. Okay, head banging. Head banging, this involves rhythmic hitting of the head against a solid surface, often the crib mattress. This occurs in 5 to 6% of children during infancy and toddler years. This is common at bedtime, before going to sleep, or after a child wakes during night or in the morning. Head banging typically occurs with the child lying face down, banging the head down into the pillow or mattress. In the upright position, the head is banged against the wall or headboard repeatedly. Head banging usually disappears within 18 months and might do so in as little as weeks or months. Banging can result in callus formation. Abrasion and contusion can occur at the site. So here are the nursing management of head banging. First, reassurance of the parents that head banging alone is not a sign of developmental disability. Significant injury is unlikely. Padding of the head surface can decrease the chance of injury. Parents should ignore the behavior as attention in the form concern or punishment can reinforce it. Okay, so the next one is the thumb sucking. Thumb sucking is normal in babies and young children. So a natural sucking instinct leads some babies to suck their thumbs during their first few months of life or even before birth. Babies may also suck on their fingers, hands. Okay. So babies, why do babies suck their thumbs? So babies have a natural urge to suck, which usually decreases the age of 6 months. But many babies continue to suck their thumbs to soothe themselves. Thumb sucking can become a habit in babies and young children who use it to comfort themselves when they feel hungry, afraid, restless, sleepy, or bored. Okay. Thumb sucking is normal in babies and young children, as I've said a while ago. A natural sucking instinct leads some babies to suck their thumbs during their first few months for life or even before birth. So babies may also suck on their fingers, hands, or items such as gloves. Okay, so here are the complications of thumb sucking. First, the teething problems, respiratory problems, gastrointestinal problems, palate changes, teeth push forward, back teeth, the dental bite problems. So here is the alveolar prognatism caused by thumb sucking and tongue thrust. The alveolar prognatism. Okay, so the next one is the nail biting. So this is a habit of biting or eating nails most of the time. So it is usually diagnosed after 3 years of age. It is more common in girls than in boys. So this is found in all socioeconomic classes. The peak age for the development of this disorder is 5 to 7 years or 13 to 15 years. Nail biting may be a learned behavior. So here, what are the causes of nail biting? We have two. First is the developmental causes, and the second one is the emotional factors. The first one, the developmental causes. This disorder is common in the biting stage and teething stage, gratifying oral habits. While the emotional factors, this include tension, anxiety, parental neglect, strictness, stress of exams, and excessive fear. So they get to bite their nail because of these emotional factors. Okay, so here are the complications of nail biting. First is the teething problem. The second one is the respiratory infections, gastrointestinal tract infection. And the last one is the cosmetic problems, infection in the bone of his fingertip. So here are the nursing management. No therapeutic measures are needed. So most children grow out of this habit by the age of 5 or 6 years. Try to remove the precipitants. Use various behaviors modification techniques such promise of a reward to correct the faulty behavior. Keep the child normally busy during the daytime. Suggest an alternative activity such as playing with Play-Doh or wiggling his finger around. Use of play therapy is beneficial in the management of the disorder. Okay, hyperactive child. As the name indicates excess of activity, this is commonly characterized by fails to concentrate on work, acts before thinking, shifting quickly from one activity to another, inability to sit quietly. So this is what a hyperactive child is. Okay, so what to do? First, reward child for only small amount of work and then gradually helping them to increase attention span. These children are hard on toys, so toys should be durable and which do not hurt child. Maintain peace and quiet time, maybe ever for a short period. The child should be encouraged to sit or lie down. Parents might read a book holding the child on the lap. The nuts. Do not over-control or overprotect the child. Child should not be allowed to take excessive tea, coffee, chocolate, and synthetic drinks. Do not keep valuables, breakable, or dangerous objects within easy reach of children as they are more prone to accidents. And lastly, do not threaten, forbid, or correct the child as after a while child gets used to the shouting that he does not pay attention to the words. Okay, so the last one is the masturbation. Masturbation is the stimulation and manipulation of one's own genitals in order to experience erotic feelings and possibly leads to orgasm. Masturbation is common in both sexes and the preschool years and in early adolescence. The child experiences pleasurable sensation which leads to repetition of the behavior. The child may obtain pleasure by genital stimulation, rubbing of thighs against each other, or by rhythmic swaying movement. Causes: conflict of feelings of child against parents. In the toddler, these activities increase in intensity and in frequency. Preschool children behave sexually with parents and other adults by rubbing their bodies against them and by seeking close, intimate body contact. Management: the parent should know the masturbation is not harmful to the child, but the child is curious about his sexuality. Parents should not scold or show negative attitude towards their behavior. It can lead to resentful anger toward frustrating parents. Just ignore this behavior of the infant and advise the child that masturbation is not acceptable in public. It should be conveyed in a non-threatening manner.
Good day, everyone. My report is all about behavioral concept, middle childhood by yours truly, Maria Schoenberg G. Dasmariñas. Enuresis. It is the inability to maintain urinary control during sleep. Primary enuresis refers to inability to maintain urinary control from infancy. Secondary enuresis is a relapse after control has been achieved. So what are the causes of enuresis? The first one is anxiety, stress, urinary tract infections, a small bladder, abnormal urethral valves in males, spinal cord abnormalities, slow development of the central nervous system, nerves that control the bladder mature slowly, leading to inability to recognize a full bladder, and hormonal factor. So what are the complications of enuresis? The first one is urinary tract infections. Individual feel ashamed or embarrassed. Individual wish to avoid situations that lead to embarrassments such as cramps or overnight visits to relatives and friends. Management. What are we going to do first is parental counseling. Remove psychological factors leading to these problems such as separation from parents, parental neglect, marital disharmony, excessive punishments, criticism in front of the others, and etc. Next, the toilet training should be given properly. It should not be too lax nor too be short. Toilet training can be delayed to 5 years in case of mentally retarded children. Behavior modification. Mower and Mower devised an apparatus in 1938 consisting of an alarm buzzer which could be set off by the discharge of urine onto a detector circuit, and child wakes up from the sleep to pass the urine at the right place. Also, there are drugs such as oxybutamine 2.5 to 5 mg 2 to 4 times a day, or imipamine 25 to 50 mg can be used at the bedtime. Situational manipulation. Wake the child during the course of sleep in the night to pass urine. Restrict fluids such as water, milk, juice, soup at least 1 to 2 hours before sleep. Next, encopresis is involuntary fecal soiling in children who have usually already been toilet trained. Children with encopresis often leak stool in their undergarments. Prevalence. The estimated prevalence of encopresis in a 4-year-old is between 1 and 3%. The disorder is thought to be more common in males than females by a factor of 6 to 1. Diagnosis. Repeated passage of feces into inappropriate places, whether voluntary or unintentional. At least one such event a month for at least 3 months. Chronological age of at least 4 years, equivalent developmental level. The behavior is not exclusively due to the psychological effect of a substance. Example, laxatives or general medical condition. The types of it were continuous type. In this type, the child is never trained, aggressive, overactive, shameless, child low socioeconomic family. Discontinuous type. In this type, the child is once toilet trained but soils later in response to stress, a neurotic, ashamed, and the child is also called reactive encopresis. The causes are genetic factors, organic causes, and emotional factors. Clinical features. Frequency of soiling varies from once to several times a day. It occurs in school. He child is 10. child is prone to anxiety reaction, poor self-esteem, withdrawn and stubborn child, less time spent with peer group. The next one is stuttering. Stuttering, defect in speech characterized by hesitation, stumbling, spasmodic repetition with pause. What are the causes of stuttering? First one is genetics. Other speech and language problems of developmental delays. Differences in the brain processing of language. Management. The parents of a young with primary stuttering should be pressured and advised. Parents should be told that the speech is non-fluent between the ages of 2 to 5 years. They should not show undue concern and accept his speech without pressuring him to repeat and making him conscious of his handicapedness. Also, the other children with secondary stuttering should be given emotional support and referred to speech therapist. The next one is pica. What is pica? It is a habit of eating non-eatable substances such as mud, plaster, paper, clay, and others. It is normal in infants up to 2 years. It is common in boys than girls. The peak age for development of this disorder is 20 to 26 months. The prevalence of this disorder falls with age. What are the causes of pica? Cultural factors, organic causes, and also emotional factors. The complications are worm infestation, cholera, typhoid, constipation, and also poisoning. Nursing management. Identify the cause of pica and try to remove the cause. Identify and remove the precipitants. If the cause is any organic disease, then refer the patient to the child specialist. Ask the parents to change their attitude towards the child. Ask the parents to scold the child. Oral substitutions can be used. And the last one is give proper explanations to the child. That would be all. Thank you. From the reporters, Maria Shenberg G. Dasmariñas and my partner, Rachel B. Para.